A Central Indiana mom wants her daughter to get the COVID vaccine because the little girl has underlying health issues.
But instead, in that process, she said she found nothing but confusion. Emily Longnecker explains why more families are running into these very same problems.
Oh my God.
That's Molly Child's reaction to a text from her 4-year-old daughter's pediatrician.
This patient does not have qualifying conditions, or they may wait until guidelines are updated mid-September.
Child's been trying to get her daughter Felicity the newest COVID vaccine because of Felicity's underlying health conditions: 2 holes in her heart, epilepsy, and a rare genetic disease that makes it hard for Felicity to breathe, even when she's not sick.
I've spent the last 4 years essentially relying on medical advice to keep my kid alive.
These days, though, Child says she can't seem to get a straight answer about getting Felicity an updated COVID vaccine or whether her insurance will even cover it.
Why would you not give her a $300 vaccine and hopefully keep her out of the hospital, which is going to cost you way more money?
Child says her daughter's neurologist is willing to write a prescription for the COVID vaccine, something she's never needed before. But when Child's called pharmacies to see if they have the vaccine,
I haven't been able to find it anywhere so far.
Just last month, the FDA approved the new vaccine. Next week, the CDC's Advisory Committee on Immunization Practice is expected to decide on recommendations for who should receive the vaccine. In the meantime, Childs continues to check the CDC's website. The guidance she sees right now says people who are immunocompromised, like Felicity, should get the COVID shot.
I literally just highlighted this stuff on the CDC right there.
Childs says several healthcare professionals told her they're waiting on the CDC's new guidelines.
I think that they're stuck in between a rock and a hard place. I think that they are not being given the choices that they think are medically right because they've been left in this limbo with no real guidance.
Childs feels like she's racing against time before those new guidelines come out.
I think that if I don't, I'm concerned that there won't even be any loopholes left.
All this without even considering her other kids, both perfectly healthy. She's been told she'll likely have to pay out of pocket for their new COVID vaccines.
I've never paid for a vaccine in my life.
Child says that's what she'll do if she has to, because Felicity's life could depend on it.
It's not a cold for her. It is a serious illness.
Emily Longnecker, 13 News.
The CDC is meeting later next week to decide what the new recommendations will be for cases just like this.